which results in the approval of youth-related bills and resolutions.
Young people are
The #NowPH in close coordination with the Climate Change Commission and Yes Pinoy Foundation.
Usually hold planning sessions, workshops, and strategic plannings and all for are being environmental
and resource generation in Marawi City.
The NYC also helped the youth to establish goodwill, friendship, and cultural understanding through the annual Ship for Southeast Asian and Japanese Youth Program, or SEA, Japan.
To ensure access and participation to these NYC-initiated programs nationwide, youth and youth-serving organizations were encouraged to register with NYC.
To contribute in providing services to the nation, were given a platform through the National Youth Volunteers Program. Both programs are lodged under the Kabayani.
Somehow, kulong sa university yung mga ginagawa kong projects. Pero nung na-open, ako sinabago ng National Youth Commission. Mas nakita.
Lastly, to national strengthening of the NYC to create new and reclassify existing positions is now implemented to better serve the Filipino youth.
The NYC, together with other institutions, nurture the youth to contribute in nation building.
Harnessing the full potential of the youth
And supplementing government appropriations
is
to
the National Youth Commission, the voice and advocate of the youth.
Kabataang Pinoy.
Sino ba kami talaga?
May mga dahil sa aming mga huwa ng National Youth Commission ang National Youth Assessment Study o NYAS para mas lalo nyo kaming maintindihan.
Para makumpleto ang study, kinonsulta ng NYC ang 2,762 Filipino youth respondents.
Na may edad na 15 hanggang 30, mula sa urban, katulong ang iba't ibang ahensya, organisasyon at mga kabataan.
2,762 kabataan aged 15 to 30 ang nakasama sa survey, representing the rural-urban areas of each region.
Na binubuo ng core youth, child youth, at young adult.
21 years old ang average age. Kamusta naman ang marital status namin, mga bes?
Karamihan ay single and available. Samantalang the rest ay married, cohabiting, separated, at widowed. Ito ang breakdown ng marital status among the core youth, child youth, and young adult. 24.6% na ang may mga anak.
Pagdating naman sa household characteristics, ito ang statistics ng mga nakatira sa isang tahanan with an income less than 10,000 a month. Kung saan nagtatrabaho lang ang tatay o nanay. Pareho nagtatrabaho o parehong unemployed.
At kami ay either in our own houses, or renting houses, or in rent-free houses. Samantalang sa urban youth naman, 74.5% are in our own home, 14.9% are in rented house, at 0.3% ay in rent-free house.
Sa edukasyon naman, among the 15 to 24 years old, 51.5% ang game na game sa pagsagot sa homework ni ma'am dahil sila ay in-school youth.
Samantalang 24.2% ang out-of-school youth. At tinatanong kami kung ano ang means of financing ng aming education? Among in-school youth, karamihan ay from parents. Ang iba ang sagot ay no response. Ang iba from relatives, through financial aid, at iba naman ay self-supporting. Kamusta naman ang employment status among in-school youth?
Ang paghahanap ng trabaho. So, curious ba kayo on what our thoughts are on education?
66.9% ng in-school youth o 64.3% ng kabuoang respondents ay nabigyan ng passing grade ang quality ng edukasyon sa bansa.
Kasi naniniwala kami na ang susi sa magandang trabaho ay edukasyon.
Tumpak! 65.3% ng working youth ay di pa nakakagraduate from college.
63.2% ng in-school youth ay nag-aaral beyond class hours.
Go, 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 kabataang Pinoy!
Ayon sa survey, ang educational attainment ng out-of-school youth ay
Karamihan ay nakapagtapos ng high school, pero di nakapagtapos ng kolehiyo dahil sa family responsibilities.
At lack of interest.
Fast facts sa employment.
Out of the 2,762 surveyed, 21.8% ang employed. 23.2% ang unemployed.
7.4% of the child youth, 24.3% of the core youth, at 36.3% of young adults ay may trabaho during the time of the research.
58% ay may full-time job. Samantalang 33.8% naman ang may part-time job.
65.4% of working youth ay di pa nakagraduate.
41.3% ang nagbabalak mag-work abroad within a year after the time of the interview.
50.9% ng respondents did not give importance to job security sa paghahanap ng trabaho.
79% sa amin ang agree na better ang salary increase kaysa sa promotion.
74.2% ng out-of-school youth ang naniniwalang may sapat na oportunidad for gainful employment.
Beshi, yung mga work benefits, kamusta naman?
43.3% ng working youth ay may PhilHealth benefits from their employers. 36.7% ang may GSIS o SSS. At 26.2% ang may pag-ibig benefits. Ano naman ang say ng research sa usapang pangkalusugan?
Magandang pag-usapan yan! 20.8% ng kabataan sa research ay naninigarilyo. 4.5% na ang nakasubok ng pinagbabawal na gamot. Samantalang 47.3% ay may enough knowledge on illegal substance.
Pagdating naman sa mental health, 25.7% ay minsan sa buhay nila ay inisip na ang buhay is not worth living.
At shocking! 14.2% considered and took steps in committing suicide.
Nakakasad naman.
20% ang nakaranas ng extreme emotional distress.
Pero on the bright side, 77.7% ang sang-ayon sa professional counseling.
Doon naman tayo sa...
Sa sexual and reproductive health ba?
Yep!
62.3% ng mga single youth have not engaged in sex.
65.1% sa kanila ang di sang-ayon sa sex outside marriage.
52.4% naman ang familiar kung ano ang HIV o AIDS.
At kami ay nakakakuha ng information about sex sa mga sumusunod. Pero 0.2% ang nagsabing, I don't know.
Sa mga pananaw naming sa sari-saring issue hinaharap ni Juan de la Cruz at paano siya nakikilahok, the survey says,
78.1% ang agree sa kahalagahan ng political participation. 58.9% expressed interest sa social political issues. 54.3% have tried to influence decisions and policies on issues they feel strongly about.
Pero ang 32.1% registered youth voters ay hindi bumoto sa eleksyon before May 2016. Among the respondents, 69.8% ang naniniwalang ang corruption is unavoidable.
46.5% ang satisfied sa pamamalakad ng gobyerno. At 89.6% ay taas na loud and proud maging Pinoy.
Pagdating naman sa organizational involvement, 69.8% are not members of any organization. 6.5% of out-of-school youth, or OSY, are members of youth organizations. 42% attended programs or activities arranged by their own organization. 85.4% agreed that youth involvement is crucial in disaster and emergency relief. At 68.5% actively participated in environment-related activities.
Ayon sa study, ay 13.2% ng in-school youth ay may internet access sa bahay. 12.2% sa amin ay may access sa external internet. Sa internet shop, school, sa malls at iba pa.
Nag-i-spend kami ng 4 hours average per week sa paglalaro ng computer games.
33.5% ang nagsabing social media takes up most of our time. Mga average 4.9 hours per week ang inuubos ng respondents sa mga social media sites.
In terms of social media usage, ang pinakapatok ay Facebook with 76.8%, Twitter 19.9%, Instagram 16.6%, Blog 4.8%, at 2.4% naman for other platforms. In summary, may mga bagay sa research na nakakaalarma,
Nakakaligalig
cause for concern.
o tinatawag na red flags.
Isa sa bawat 4 na kabataan thinks that life is not worth living.
69.3% ang nagsabing di maiiwasan ang korupsyon.
41% ang di familiar sa sakit na HIV o AIDS. At 5% lang get their information on sex from health centers.
20.9% have access to pornographic materials. At 20.8% sa
At 69.8% ng mga kabataan ay di involved sa anumang organizations.
Pero sabi nga nila, there is light at the end of the tunnel.
There is rainbow after the rain.
May mga windows of opportunities na lumabas sa pag-aaral.
Nakitaan ng out-of-school youth ng interest na muling mag-aral.
At madaming nagsabing ang political involvement ay mahalaga. At ang agrikultura ay mainam na source ng livelihood.
At may positive results din sa mga isyung tulad ng pakikilahok ng kabataan sa disaster and emergency relief.
At madami ding nagsabing walang masama sa pag-seek ng professional help for mental health.
At ito ang pinaka-best. 89.6% ang nagsabing masarap at proud sila.
Pinoy,
Isinagawa ang survey na ito para makagawa ng long-term plan o Philippine Youth Development Plan 2017 to 2022 na magpapabuti sa kalagayan naming mga kabataan.
pero posible lang ito kung makikipagtulungan ang lahat.
Dahil sa pagtutulungan,
Achieve ang magandang bukas!
Nation building? Big word!
Pero Besh, huwag ma-intimidate.
Ang totoo, carry natin mga kabataan yan.
Pet malo kaya tayo.
Pero sometimes, the struggle is real talaga.
Kaya naman, sagot tayo dyan ng Philippine Youth Development Plan o PYDP.
Ito yung hopes and dreams ng gobyerno para sa ating mga kabataan.
Para by 2022, we're all productive citizens of the Philippines.
Oo, tayong lahat.
Mga kabataan, ages 15 to 30 years old,
Nag-aaral man, out of school youth, nagtatrabaho, pati na rin mga kabataang may specific needs.
so what does it all mean?
It means, lahat tayo natutulungan ng gobyerno to achieve our full potential.
We're healthy, educated, may trabaho o negosyo, at kahit huma-hashtag travel goals, may pakialam pa rin sa country.
Lahat ng ito para inspired tayo mga kabataan to do our part for inang bayan.
Dahil tayong mga kabataan bilang susunod na mga leader ay importante sa ating bansa.
So how do we do this? Una, healthy living. May access tayo sa sapat na medical attention, nakakapag-exercise, at may proper diet and nutrition.
Sexually responsible din tayo at informed sa risks.
Pati sa mental health, full support din para sa mga kabataan.
Lahat tayo may access sa quality education.
Kumpleto sa gamit ang bawat classroom at mahusay na ang lahat ng teachers.
So we can all be globally competitive.
After graduation, we have options kung anong field ang gusto nating pasukin. Artist ka ba?
Pwede.
Professional?
G rin.
At kung
Banan. Kasi pantay-pantay tayong lahat.
nire-respeto at sumusunod din tayo sa batas.
And we help build a safe and peaceful place to live in.
We're also conscious of our impact to the environment.
Para siguradong ma-enjoy at mapapakinabangan ng susunod na henerasyon ang ganda at likas yaman ng Pilipinas.
To lead.
Gamit ang ating innovative ideal sa bayan to introduce change in our communities.
Pwedeng sa government,
o sa non-government organizations.
Ang mahalaga, makabuluhan ng ating contribution.
Sa ating bayan o nation building, mahalaga tayong mga kabataan.
Kaya ang pagsasagawa ng PYDP, pagtulong yan sa ating mga and participate
Para sabay-sabay natin ma-achieve
ang ating national squad goals.
dahil tayo
Advocating policies on youth protection and
Tribe, the National Youth Commission, or NYC,
the agency for and with the Filipino youth,
the
18 to 30 years old.
sustainable developmental policies and programs.
2022 enjoins all state duty bearers at the national and local levels to maximize the participation of the youth in nation building as responsible and proactive citizens.
One of the foundations in the formulation of the 6-year PYDP is the National Youth Assessment Study, or ENYAS, which
YC is the development of Sangguniang Kabataan Operations Manual and the mandatory training modules which are mandated under the SK Reform Act of 2015. This hones the youth to become better leaders.
We are thankful because through the next mga modules natin, we were sharpened, we were actually harnessed as to how are we going to improve more our duties and responsibilities as an official, as the Sangguniang Kabataan official representing the youth sector in our community. Isa sa mga remarkable modules or mga trainings na nasalihan ko with the National Youth Commission is on the recently concluded testing on resource mobilization. It was one way our connections. How do we make use of the partnerships, not just depending or relying on the resources that we have in the local government unit, but at the same time,
Good afternoon, everyone. Our program will begin in 5 minutes.
On a Saturday night in the summer, sundown and they all come out. Lamborghinis and they're renting hummus. The party's on, so they're heading downtown. Everybody's looking for a come up, and they wanna know what you're about. Me in the middle with the one I love, we're just trying to figure everything out. We don't fit in well, 'cause we are just ourselves. I could use some help getting out of this conversation. Yeah, you look stunning, dear, so don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row at fashion shows. What you do and who'd you know inside the world of beautiful people. Champagne and rolled up nose, prenups and broken homes. Surrounded but still alone. Let's leave the party. That's not who we are. We are not beautiful. Yeah, that's not who we are. We are not beautiful. Drove for hours last night and we made it nowhere. Now I see stars in your eyes when we're halfway there. I'm not fazed by all the lights and flashy cameras, 'cause with my arms around you, there's no need to care. We don't fit in well, we are just ourselves. I could use some help conversation here. No looks done in this. Don't ask that question here. This is my only fear, that we become beautiful people. Top designer clothes, front row at fashion shows. What you do and who you.
Good afternoon once again. May I request to please stand for the invocation to be followed by the Philippines National Anthem.
Praise God, praise Him, all creatures here below. Praise Him above ye hosts. Praise Father, Son, and Holy Ghost.
Once again, everyone, please welcome your host for today, Mr. Dion Michael Mendoza.
Good afternoon, everyone. I am Dion, and it is a pleasure to be in front of you today for NYC's HIV Awareness Webinar. Today is a meaningful day as we commemorate World AIDS Day. Since 1988, the global commemoration of World AIDS Day has led in raising awareness about the global epidemic that is HIV/AIDS. This day is important as it reminds us, especially the young people, that HIV/AIDS has not gone away and there is a lot left more to be done. So, welcome to our webinar. And just a little reminder to our viewers, if you have questions or insight regarding our presentation for today, please type them in the comment box that is located at the bottom of your screen. So anytime during the discussion, you may write your questions in there or insights, and we'll be reading them later. So we will also have a time for questions during the Q&A portion of this program. So also, if you have your own HIV awareness celebration, so don't forget to tag NYC in all of your posts and use the official hashtags EndHIVTogetherPH and World AIDS Day PH. And so right now, we already have a lot of viewers and people here in Zoom, and we are actually expecting a total of 245 participants from our Zoom registration. So I'm hoping that you would use this opportunity as well para makapag-network tayo with people who are also advocates of HIV and AIDS awareness. So all right, to formally open this webinar, please welcome on the Zoom stage NYC Commissioner at Large and Chairperson of Committee on Health, ASEC Lawrence Anthony Jestro, for the welcome remarks.
Magandang tanghali sa inyong lahat. Naririnig niyo ba ako?
Yes po, narinig po namin kayo.
Maraming salamat, Dion. So, 32 years ago, siguro pareho sila ng minanais katulad ng nais nating mangyari ngayong araw na ito, na magkaroon ng pagkakataon na i-celebrate natin hindi lamang ang mga oportunidad na naibigay natin sa mga taong nagkaroon ng HIV na mabago ang buhay nila, kundi ang incredible progress ng humanity sa paglaban sa epidemic na ito. This day, we envision this commemoration as an opportunity to speak a little louder, to raise awareness in the fight against HIV. Ang tema ngayong taon ay Ending HIV/AIDS Epidemic, Resilience and Impact. Dahil sa current health situation, mas nakita natin ang importansya na mas maaga na ma-detect ang HIV and AIDS sa pamamagitan ng tamang impormasyon, sa pamamagitan ng mga seminars at webinars tulad nito upang maipaabot natin sa lahat ng kabataang Pilipino at mga Pilipino ang dapat nilang malaman tungkol sa HIV and AIDS. Napaka-importante ng mga pagpupulong kagaya nito sa panahon ng COVID-19 pandemic. Dahil despite the fact na hindi tayo pwedeng magkaroon ng face-to-face seminars, marami tayong naabot ng mga kabataang Pilipino na mapaabot ang tamang mensahe at malaman nila ang dapat nilang malaman tungkol sa HIV. Excited ako today dahil kagaya last year na nagkaroon tayo ng health awareness program for the Pinoy youth, isa na namang programa ng National Youth Commission ang nag-i-aim na mapabuti ang kalusugan ng kabataang Pilipino. Kasama natin ang mga volunteers, kasama natin ang mga advocates at mga experts sa larangan ng kalusugan ngayong araw na ito na magiging bahagi ng ating programa. Isa na dito si Sir Iko, Rodulfo, Johnson, nakapartner din natin last year mula sa Project Red Ribbon. Kasama rin natin si Undersecretary Marjorie. Hello?
Yes po, okay na po. Narinig na po namin
Yes,
kayo.
na-mute yata. Kasama rin natin si Undersecretary Marjorie. Kasama rin natin si Undersecretary Marjorie Alasos mula sa DALG upang magbigay ng mensahe. At bago ko tapusin ang aking welcome remarks, ina-affirm ng National Youth Commission ng mga kasama kong opisyal ng Pambansang Komisyon sa Kabataan sa pangunguna ng aming chairman, Yusek Ryan Enriquez, na patuloy nating itataguyod ang kapakanan at karapatan ng kabataang Pilipino. At panghuli, tandaan natin na hindi lamang impormasyon, programa, polisiya at mga proyekto ang ibinibigay natin. Sa mga pagkakataong gumagawa tayo ng mga aksyon patungkol sa development ng kabataang Pilipino. Ang importante dito ay binibigyan natin sila ng pag-asa na magkaroon ng isang mas magandang kinabukasan at pag-asa na maaaring matapos ang pandemic ng HIV sa ating generation. Muli, magandang araw at maraming salamat sa inyo.
Thank you, Com Lawrence, for the warm words of welcome. So this day is indeed a special day for young Filipinos as we gather here today to learn how to rein in the HIV epidemic and collectively act to raise awareness among our peers. So speaking of putting a stop to HIV infections, so our first speaker is the President and CEO of Project Red Ribbon Care Management Foundation, Incorporated, which is an HIV and AIDS advocacy foundation composed of advocates, supporters, and persons living with HIV. Project Red Ribbon's mission is to improve the quality of life of people living with HIV through awareness, prevention, treatment, care, and support. So without further ado, ladies and gentlemen, let us welcome Mr. Iko Rodulfo Johnson.
Hi, good afternoon to everybody. Magandang hapon po sa inyong lahat. Naririnig niyo po ba ako?
Good afternoon po, Mr. Iko. Yes, we can hear you po.
Yes, so thank you very much, the National Youth Commission, for once again inviting Project Red Ribbon, and in behalf of people living with HIV all over the Philippines, which I represent or we represent as a council member of the Philippine National AIDS Council. Mabuhay po sa inyong lahat. Ngayong araw na ito ay ating ginugunita at sineselebrate. Bakit natin sineselebrate? Kasi World AIDS Day is a celebration of life of people living with HIV, as well as we celebrate the successes of the HIV programs of the different government agencies and civil society organizations. At maganda ang tema natin ngayon dahil ang tema natin is Global Solidarity and Shared Responsibility. Ang ibig sabihin ay kailangan tayo ay united sa paglaban sa paglaganap ng HIV at tayo ay lahat maging responsable. Hindi lamang ito responsibility ng government agencies, ng mga stakeholders, but pati tayong lahat. Kasi sa pakikipaglaban sa HIV, dapat we don't leave anyone behind. Lahat tayo ay nagtutulong-tulong upang mapalaganap ang edukasyon at ma-reverse natin yung HIV AIDS here in the Philippines. Now, I am here to present the risky behaviors and how to reduce them, and I would relate them to HIV and COVID-19. Napaka-importante kasi nating maintindihan, lalo na sa mga kabataan, na kailangan ng edukasyon. Kailangan natin maituro ang tama, kailangan mabigay natin ang tamang edukasyon upang mabawasan natin yung mga risky behaviors. Okay? Can the host help me because my deck is still disabled? Yung sharing ko. Can you help me po? Naka-disable yung share screen ko. Okay, so habang inaayos nila yung pag-share ko ng deck, muli sa buong Pilipinas ang nangunguna, ang nagsi-spearhead ng World AIDS Day Philippines 2020 ay ang Philippine National AIDS Council, na kung saan ang National Youth Commission ay kasama. Okay. Now I can share my slide, my deck. Nakikita niyo po ba?
Yes, sir. We can see it po.
Okay. Kagaya ng sinabi ko, nangunguna ang Philippine National AIDS Council, na kung saan ang National Youth Commission at ang Project Red Ribbon ay kasapi. Sitting members po kami ng Philippine National AIDS Council. At sa pagtutulungan ito ng government agencies and civil society organizations, ay mababago natin ang mga polisiya, mabibigyan ng tamang edukasyon ang lahat ng Pilipino laban sa HIV and AIDS or patungkol sa HIV and AIDS. Now, my topic today is reducing high-risk sexual behaviors in HIV. Dahil World AIDS Day ngayon, ang risky behavior sa pag-uusapan natin ay iaangkla natin sa HIV. At idadagdag natin ang COVID dito. Because naniniwala Project Red Ribbon na kung tayo ay may sapat na kaalaman, ay mapupuksa natin o mapre-prevent natin or mare-reverse natin yung HIV epidemic here in the Philippines. Now, at the end of this talk, sa dulo ng aking presentation, ay pag-uusapan natin yung mga high-risk sexual behaviors. So, kailangan buksan natin yung isipan natin kasi karamihan sa mga affected or highly impacted population ay ang youth. And number 2, yung impact ng COVID-19. Ano ba yung impact ng COVID-19 sa high-risk sexual behavior? Kahit may quarantine tayo, nagbubukas ang ating gobyerno, nagbubukas ang mga establishmento at nagre-relax sa mga tao patungkol sa quarantine. Pero ano ba yung nangyayari sa mga high-risk sexual behaviors dito sa Pilipinas? Tumataas ba sila? Bumababa? Doon makikita natin. Lalong-lalo na kung ikukumpara natin yan sa HIV. At pangatlo, yung reducing sexual risk-taking behavior. Paano ba natin talaga mapapababa ito? Yung mga risk-taking behaviors, lalong-lalo na yung kabataan. Okay, what are high-risk sexual behaviors? Ano ba yung risky behaviors? Risky sexual behavior is the description, okay, is the description of the activity that will increase the probability that a person engaging in sexual activity with another person infected with the sexually transmitted infection will be infected. So, ang pinaka-risky dito sa isang sexual behavior ay kung saan makakakuha ka ng mga sexually transmitted infections. O kaya maipapasa mo yung sexually transmitted infection na kung saan ikaw ay meron sa iyong kapartner or sa iyong loved one. So, para lang yan, ikukumpara natin sa HIV. Sa HIV, ito ay isang infection na up to now, wala pa ring cure. Although manageable, libre lang yung gamot coming from the Department of Health sa iba't ibang treatment facilities all over the Philippines. So isa tong sexually transmitted infection katulad ng iba't ibang sexually transmitted na ipapakita ko. At hindi ko na kailangang ipakita mga pictures kasi minsan sa mata ng kabataan parang nakakadiri silang tignan. Pero tandaan natin ang HIV at yung mga sexually transmitted infections ay nakukuha sa unprotected sex. Buksan natin ang usapan natin. World AIDS Day po ngayon. So pag-usapan natin ang sa aking presentation ay pag-uusapan natin yung mga sexual behavior, sex and behaviors. So kailan bukas ang isipan natin, lalo na sa paggamit ng condom, protection. Kasi nakukuha itong mga sexually transmitted infection kung ikaw ay hindi gumagamit ng condoms. So kailangan pag-usapan natin. Kasi yun ang problema eh. Minsan hindi natin na pag-uusapan. Kaya minsan meron na tayo, hindi natin alam kung saan tayo pupunta. So napaka-importante niyan. What are high-risk sexual behaviors? Examples nito, unprotected intercourse, direct to the point, condomless sex. Okay? So kailangan sabihin natin, kasi 2020 na ngayon, kailangan pag-usapan natin ang sex and prevention of risky behaviors. Okay? Unprotected mouth to genital contact, ito yung oral sex. Katulad ng sinabi ko, buksan natin yung isipan natin tungkol sa usapin na ganito. Number 3, starting sexual activity at a younger age. Alam nyo ba, mamaya papakita ko sa inyo na ang sexual debut ng Pilipino ay mababa. Okay? Pero mas mababa pag tumingin ka sa Amerika at saka sa Europe. Kaya yung atensyon ng educational system ay nakafocus kung kailan ang population magkakaroon ng sexual debut. Anong ibig sabihin ng sexual debut? Yung time na kung saan nakakapag-isip ka na about sex. Okay? Napag-isipan mo na yung sex at saka sexual behavior. Ito yung nagtatanong ka na, nag-check ka na sa internet. Sa Pilipinas, mataas pa rin. Nasa around 13 to 14 ang sexual debut natin. Kaya kung saan ang educational system natin ay nakafocus around yung gravity ng education natin ay nandun sa high school level. Samantalang sa Europe at saka sa US, nakafocus talaga sila as early as sa grade school. Doon pag-uusapan natin mamaya. And then the younger people are when they start having sex, the greater the risk is of getting STI. Kung kayo, lalo na mga kabataan, ay maaga namulat sa sex and sex behaviors, mas mataas ang tsansa or probability na magkaroon ka ng sexually transmitted infection. And of course, yung having multiple sex partners. Yung dahil nag-e-explore ka, dahil...
Sir, excuse me.
Yes,
Can
sir?
I go first inside the comfort room first? Ihi muna ako, sir, ha?
Hello? Hello?
Sige sir, you may proceed na po.
Sorry, baka hindi para sa akin yon. Okay, and having multiple sex partners. Ito yung mga meron kang nagkaroon ka ng partner pero nag-e-explore ka. Na understandable naman kasi napupukaw na yung kaisipan mo o kaya lumalawak na yung kaisipan mo. Pero kung hindi natin tatapatan ito ng tamang information, then magkakaroon tayo ng mga risks, especially HIV. What are high-risk sexual behaviors ulit? Ito yung having a high-risk partner, one who has multiple sex partners or other risk factors. Alam nyo ba, isa yan sa mga factors na kung saan tumataas yung HIV? Yung tinatawag nating faithfulness. So sometimes, faithful ka sa partner mo, pero yung partner mo hindi man faithful sa'yo. So yung partner mo maraming sex partners, so maaari kang mahawaan ng HIV or other STIs. And then having unprotected anal sex or a partner who does. Okay? So ibig sabihin ito, hindi ka gumagamit ng protection, direct to the point tayo, yung condoms during anal sex, buksan natin yung isipan natin. Or yung partner mo hindi gumagamit ng condom na pwede kang mahawahan. And then second to the last, having sex with a partner who injects or has ever injected drugs. Okay? Ito ay isang factor or isang mode of transmission ng HIV na kung saan people who inject drugs are the one vulnerable population. Ibig sabihin nito, yung nagamit ng karayom during drug use ay naipasa sa isang taong gumagamit din ito. Usually ito yung mga sa sessions, etc. So nagpapasa-pasahan, kaya tapos yung isang tao ay may HIV pala, hindi alam ng lahat, nahawahan na sila. So napaka-risky yung sharing of needles among people who inject drugs. And of course, yung sex trade. So dito sa Pilipinas, ang lahat ng social hygiene clinics ay nagtuturo pa rin ng tamang proteksyon laban sa STI and HIV. Dahil, syempre, hindi natin maiiwasan. Sabi nga sa economics, pag tumataas ang tourism, tumataas din ang STIs, ang HIV, or other infections. Kasi nga, ito yung mga transactional sex na hindi natin maiwasan. Parang may mga, let's say, pumunta ka sa isang probinsya na mataas ang turismo, even yung mga tour guides nakikipagtalik na sa kanilang mga kliyente, o kaya merong mga examples ng mga masahista na nakikipagtalik sa kapwa lalaki because of money. So ito, ang kailangan lang natin is maintindihan natin na ito yung dynamics ng lipunan. Pero ang pinaka-importante dito ay mabigyan pa rin sila ng kaukulang kaalaman laban sa STI and laban sa HIV as part of educating against highly risky behaviors. Now, reasons for high-risk behavior. People may have high-risk behavior because may not understand the concern about STIs. Hindi nila naintindihan kung ano yung mga concerns natin sa STI. Ano nga ba yung mga STI signs and symptoms? Hindi nila naintindihan. Kung ako tatanungin ko kayo personally, malamang iisa-isahin ko kayo, pero dahil virtual to, sasabihin ko na lang ano yung mga signs and symptoms nito. Ito yung pain in urination, pag kayo umiihi, masakit, o kaya may lumalabas na discharge, o kaya meron tayong mga warts o tumutubong kulugo, o kaya may mga rashes dun sa genital area natin. Yun hindi naiintindihan, na ito concerning. Bakit concerning? Kasi pag ikaw ay may STI o sexually transmitted infection, mataas din yung tsansa na ikaw ay mahawahan ng HIV. Kasi ulitin ko, bakit ka nagka-STI? Kasi hindi ka gumamit ng condom. Okay? Protection. And how they are transmitted. Hindi natin naintindihan kung paano nga ba nakuha ang sexually transmitted infection. Ang concern natin dito, kasi ang HIV up to now wala pa ring cure. Samantalang ang ibang STIs ay ito ay manageable, may mga treatment. May mga cure, pero ang HIV wala. Pero ang kinagandahan nito, dahil manageable ang HIV, libre lang naman yung gamot coming from the Department of Health sa iba't ibang treatment facilities, dapat hindi tayo matakot. Kailangan bigyan ng tamang edukasyon. Okay, next natin dito, may not talk about safer sex practices with sex partners. Ang tanong ko sa inyo, kailan nyo ba napag-uusapan ng sex? Or kailan nyo nalaman ng sex? Diba? mismong sa bahay natin, tanggapin na natin yung katotohanan na hindi naman na pag-uusapan ng sex and sexual behavior. Kaya napaka-importante sa lahat ng kabataan na pag-usapan. Napakagandang opportunity ito na pinag-uusapan natin ng sex and sexual behavior kasi para maiwasan na yung mga sexually transmitted infections as well as HIV. Ganun din, hindi natin pinag-uusapan ang sex sa ating mga sex partners. So malamang makikipag-partner ka, makikipagtali ka na hindi pinag-uusapan ng sex at hindi pinag-uusapan yung history when it comes to your medical status as well as your sexual behaviors. Or you're not prepared or don't understand how to use protective measures to prevent STIs. Marami pa rin ang hindi nakakaalam kung paano gamitin ang condom. So, napaka-importante na mabigyan sila ng tamang information on the right use. Kailangan consistent pa rin tayo. Palaging may bit-bit, lalo na kung hindi mo alam kung saan ka pupunta at hindi mo alam kung saan hahantong ang inyong relationship. So, marami pa rin ang naglalagay ng condom sa kanilang wallet o kaya naiinitan yung wallet o hindi nila alam kung paano yung tamang paraan para gamitin yung condom at paano i-dispose. Okay? Or may not be aware of signs and symptoms of STI na pinaliwanag ko kanina. And may not seek medical care kasi nahihiya. Di ba? Ako ay isang taong may STI. Ako ay isang taong may HIV. Nandito yung takot na maaari tayo ma-stigmatize. Stigma yung yung paningin ng ibang tao sa atin. Na ako ay may sakit dahil nakuha ko sa sex, dahil sa sexual behavior. So maaaring hindi ako magpatingin lalo na kung ako ay isang kabataan. Or may not have access to treatment. Okay? Dahil hindi natin alam kung saan tayo pupunta. Samantalang ang lahat ng mga social hygiene clinics ay nag-o-offer ng sexual ng STI screening as well as HIV screening. O natatakot tayo, baka mahal ang gamutan. Samantalang, merong mga benepisyo galing sa ating gobyerno na kung saan ay mabibigyan ka ng libreng treatment. Or may use alcohol and drugs and have sex. Ito ay isang mode of transmission na naman. No? At ito ay isang way para to prevent HIV na hindi dapat uminom ng alak or mag-inject ng drugs during sex. Kasi lahat ng napag-usapan, lahat ng naintindihan nyo about HIV ay makakalimutan nyo. Dahil ang drugs and alcohol impair judgment and make unsafe sex more likely. Kasi sabihin na natin, buksan na ating isipan, nandun ka na, and then, tapos under the influence ka, malamang mapapa-oo ka pag sinabihan kang huwag kang gumamit ng kondom. So napaka-importante na huwag natin pagsamahin ang drugs and ang alcohol. Now, a brief glance of HIV and risky behaviors. Napakaganda nito kasi kalalabas lang nung HIV and AIDS Art Registry of the Philippines at according to the Epidemiology Bureau of the Department of Health, by the end of 2020, magkakaroon ng 111,000 Filipinos living with HIV. So napaka-importante niyan. Pataas ng pataas ang kaso ng HIV. At according to the report from the Epidemiology Bureau, babalikan lang natin briefly, tignan lang natin, merong 81,169 kaso ng HIV since 1984 at meron tayong 6,362 cases in 2020. Kung tutuusin, bumaba yan. Kasi ang testing natin because of COVID ay bumaba rin. Pero napaka-importanting tignan natin na kahit may pandemic tayo, meron pa rin tayong HIV epidemic sa Pilipinas. Okay, briefly lang, according to the HARP, eto kalalabas lang ngayong araw na to, ay makikita nyo na 15 to 24, okay, 29 cases of HIV as of October 2020. Bakit delayed ang HARP report? Kasi dahil nagbibigay sila ng ample time for all the treatment facilities and testing facilities to submit their report. And makikita nyo more than 50% nasa 25 to 34 and 35 to 49 ay 18%. Ano ba yung coverage ng youth natin? Hindi ba nasa unang dalawa? So ibig sabihin, tayo yung mataas, tayo yung population na maaaring mataas ang kaso ng HIV dito sa Pilipinas. At kung titignan ninyo, as of October 2020, okay, 53%, okay, ay nasa male-to-male sex, sexual contact, unprotected sex. Ito yung modes of transmission. And 27% sexual contacts, sex with males and females, bisexual. Would you believe na ang Project Red Ribbon ay nagpunta sa isang university belt sa Moraita at napag-alaman namin through counseling bago kami magbigay ng HIV screening, okay, ang mataas yung population nung female na 17 years old. Mataas ang population na bisexual. Na ibig sabihin, nakipagtalik na or nag-explore na makipagtalik sa kapwa nila babae at saka sa lalaki. So ang mundo or kaya ang face ng HIV ito nagbabago, bumabata ng bumabata. So napaka-importante at napakagandang proyekto ito ng National Youth Commission kasi nakikipag-usap kami sa inyo at pinapaliwanag namin at nagpapatotoo kami para maintindihan nyo kung bakit tumataas ang HIV. At 16% dito, sexual contact among male to female. Now, ito yung topographical distribution at makikita nyo na nasa National Capital Region and Calabarzon and Central Region or Central Luzon Region ang pinakamataas na cases. Hindi dahil ang concentration ng HIV ay mataas lamang dito, kundi mataas ang testing, mataas ang awareness ng Mega Manila when it comes to HIV and AIDS. Kailangan paigtingin pa natin ang kampanya for awareness and for testing and treatment all over the Philippines because up to now hindi pa rin natin alam ang extent ng epidemic sa Pilipinas. And because of the COVID-19 situation, ito ay bagong-bago, 424,297 cases. Ito ay nilabas lang kanina. Anong epekto ng COVID-19 sa high-risk sexual behavior? Makikita nyo yan sa epidemya o kaya sa status ng Epidemiology Bureau of the Department of Health when it comes to HIV. Makikita nyo na bumaba when it comes to diagnosis. Pag sinabi natin diagnosis, yung testing po yan. Bumaba ang testing. Makikita nyo as compared to last year, halos kalahati. Dahil konti lang nagpapatest, nagsarado ang mga clinics, marami ang natatakot pumunta sa mga social hygiene clinics para magpatest. At pag nakita nyo dito, bumaba rin yung enrollment sa mga treatment facilities. So makikita nyo yung epekto. So ngayon, napaka-importante na kailangan continuous pa rin yung paglaban natin sa HIV. Kanina lamang ay kausap ko ang regional director ng DOH-NCR. Ang sinasabi is malamang maaring okay, bumaba nga yung cases natin sa STI and HIV. Dahil hindi tayo pagsalimuha, hindi tayo nakakapag-communicate, walang mga gatherings, ang eskwelahan ay mga sarado. Subalit ang kinakatakutan pa rin natin ay habang nagre-relax ang gobyerno, maaaring pa rin tumaas ang kaso natin. Maaring magkaroon ng super spreader sa mga events. Magbukas ang mga hotel, magbukas ang ibang eskwelahan. Yon ay ang dapat nating paglaanan ng pansin. Kailangan sa ngayon pa lang ay magbigay na tayo ng edukasyon para ma-prevent yung biglaang pagtaas ng risky behaviors and STI and STDs. What are high-risk sexual behaviors? Okay? Ay, nabanggit ko na pala yan. Understanding risky sexual behaviors related to HIV. Alam nyo ba, according sa Department of Health Epidemiology Bureau, according to the report sa mga surveys nila, ay among males having sex with males and TG, risky behavior starts early. Protective behavior starts late. Yun ang problema natin. Ang mga kabataan ay nakikipagtalik. Karamihan sa mga kabataan na nakikipagtalik at 16 years old. Okay? And then, at 17 years old, nakakaranas na sila ng anal sex. Ang pinaka-problema dito, bago sila gumamit ng condom, it will take 2 to 3 years. So, at 19, this is the age of first condom use. So nung pinakita ko sa inyo yung diagram kanina, at 15 pa lang tumataas na yung kaso ng HIV. Imagine kung ikaw ay natuto pa lang by age 16 about HIV and risky behaviors or STIs, malamang gagamit ka based on the statistics, gagamit ka after 2 to 3 years of condoms. Maaaring nakuha mo na. So napaka-importante for all population, increased knowledge of HIV transmission prevention and services, as well yung tinatawag naming combination HIV prevention. Condoms, condom use, yung PrEP, ito ay pre-exposure prophylaxis, ito ay iniinom na. Kasi yung ibang kabataan ayaw nilang gumamit ng condom, gagamit na lang sila ng pills. Kaya lang ito ay binibili. O kaya yung post-exposure prophylaxis, ito naman, kung ikaw ay nahawahan, sa tingin mo ay nahawahan, within 72 hours, kailangan ka uminom nito. Both the PrEP and the PrEP and the PEP ay kailangan bilhin. So yun lang yung problema natin. So number 1, prevention pa rin is condom use. And to reduce no infections, especially related to high-risk behaviors, okay, napag-alaman din na 33% of males having sex with males and transgender, ito yung mga population na mataas yung HIV cases, mababa pa rin yung comprehensive knowledge nila and basic knowledge of HIV prevention and transmission. And 38%, napakababa, parang 1/3 lang, use condoms during anal sex and to male partners. And only 8% has awareness dun sa PrEP na binanggit ko na ngayon ina-accept na ng World Health Organization. Still, ang approach natin is to reduce infections through increased knowledge. Kailangan pag-usapan natin at mabigyan kayo ng tamang information about HIV and AIDS. At babalik tayo dun sa binibigay ng Department of Health para ma-prevent yung mga infections, especially yung HIV na abstinence. Ito yung sinasabi natin, wag muna, lalo na kung wala kang kaalaman about sex and sexual behavior and HIV. Letter B is be mutually faithful. Ibig sabihin, kung ikaw ay faithful, partner mo ay hindi faithful, maaari ka mahawahan ng HIV or even STIs. Consistent and correct use of condoms. Ibig sabihin, consistent, lagi kang may bitbit, Boy Scout ka, Girl Scout, or correct use of condoms, marunong kang gumamit. Kailangan pag-usapan natin ito dahil tumataas ang kaso ng HIV dito sa Pilipinas. And don't use drugs, nabanggit ko. Dagdag na natin yung alcohol. And napaka-importante yung 3 E's, education, early testing, and early treatment. Kailangan maintindihan natin ang high-risk behaviors. Paano nagsimula? At ano yung mga preventive measures natin? At isa sa preventive measures natin para hindi tayo mahawahan ng mga infections, lalo na ang HIV, is early testing. Kailangan lahat tayo ay magpa-test. Huwag na tayong matakot. Huwag na tayong mahiya. Dahil habang nagmamature ang isipan natin, nagmamature ang katawan natin, kailangan mayroon na tayong information, lalo-lalo na sa isang infection na nakakamatay para sa ating mga kabataan. And yung early treatment. Nabanggit ko na, libre ang gamot coming from the Department of Health at napaka-importante. Napaka-importante na maintindihan nyo. Nung kung kayo ay nagpa-test early on, maaga kayo nagpa-test, ay, okay, kung negative kayo dun sa HIV test, well and good and stay negative for life. But if you are HIV positive, libre ang gamutan at itong pinakamaganda. Okay? Dahil matindi ang batas natin about HIV and AIDS, pwede ka magtrabaho kahit saan. Hindi nila malalaman kung hindi mo i-disclose. At meron tayong mga polisiya at nasa batas din na hindi ka pwede ma-discriminate, hindi ka pwede mabuli. Matindi ang batas po natin ngayon. So, kung ikaw ay HIV positive, libre ang gamot, tapos meron naman PhilHealth package tayo, lalo na kung sa ating magulang o kaya kung gusto niyo maging voluntary member, ay libre naman yung konsultasyon. Libre din yung mga laboratory test. Huwag na natin ipagpabukas. Ngayon ay World AIDS Day. kailangan nating namnamin, okay? Kailangan natin bigyang pansin ng HIV ay totoo. Pero kagaya ng sinabi ko nung nagsimula tayo, ay hindi lamang ito ay responsibilidad ng ating gobyerno. Hindi lamang ito ay responsibilidad ng ating gobyerno at ng ating mga CSO partners dahil ito ay ating responsibilidad. Kagaya ng sinabi or message ng World AIDS Day, global solidarity. Lahat tayo kailangan ay united. Laban sa pagpuksa, laban sa paglaganap ng HIV sa Pilipinas, at kailangan magkaroon tayo ng shared responsibility. Ang responsibility ng isa ay responsibility natin. Kasi ang HIV ay hindi lamang para sa isang tao. Kung ikaw ay may HIV, buong pamilya mo ay apektado. Buong komunidad mo ay apektado. So kailangan nating maintindihan yon. At napaka-importante dahil ang National Youth Commission together with Project Red Ribbon ay may tinatawag na HIV and AIDS Awareness and Prevention Program for the Youth or HAPPY. At ito ay itutuloy natin, na-hamper lang dahil nagkaroon tayo ng COVID, pero itutuloy natin itong programang ito na kung saan ay gusto namin mabigyan lahat ng information, lahat ng youth organization sa Pilipinas at sumama sa advokasya sa pagpigil or pag-reverse ng HIV dito sa Pilipinas. Muli, ako si Rodulfo Johnson. Ako ang presidente ng Project Red Ribbon at nagpapasalamat sa National Youth Commission for inviting me to give a talk to all of you. At sana ngayong World AIDS Day ay mamulat ang ating kaisipan at mabigyan tayo ng tamang information about risky behaviors, about STI, and about HIV. So maraming salamat po.
And thank you so much, Mr. Iko Johnson, for that very informative and engaging talk. So before we proceed, I would like to remind everyone to please mute your microphones during the presentation to avoid na ma-disrupt natin yung discussion natin. So for many of those who have been following NYC would remember yung binanggit kanina ni Sir Iko that last year, on this day then, we launched Project Happy, or the HIV Awareness and Prevention Program for the youth. So more on that Project Happy as we continue with the program. So for now, we will be opening the floor for our questions. Again, if you have your questions, pwede nyo ilagay dun sa chat box natin, which is located at the right side, lower right side ng ating Zoom screen. So I'll be reading the questions for Mr. Iko, and Mr. Iko syempre will be answering those questions. So yan. So I have here someone from Young Achievers Association. He or she would like to ask a question. So I think you may do so. You may type it on the comment section. And good afternoon to everyone who are here right now. So yeah, we have participants all over the Philippines. No, I think I saw participants from Bicol. We also have participants from Manila, from Malabon, from Cavite. Ayan. So it's good that we have a lot of participants here right now. Ayan. So good afternoon sa ating lahat. Ayan. So yeah, I think sige, pwedeng mag-unmute. I think it's okay. Is it okay with the You can ask your question.
Hi Sir Iko, good afternoon.
Good afternoon.
Nabanggit niyo po yung tungkol sa PrEP kanina. Tatanong ko lang po, available na po ba ang PrEP sa Pilipinas?
Okay, ang PrEP ay available dito sa Pilipinas. Subalit nagkakahalaga ito, may presyo ito, hindi ito libre ng galing sa Department of Health. Ito ay nagkakahalaga mula 1,500 to 3,000, depende kung saan ka kukuha. Now, kung kukontak kayo sa Project Red Ribbon at kayo ay taga Maynila, kami yung pinakamura kasi 1,200 lang ito. Pero bukod doon, tandaan natin, meron pa yung mga laboratory tests at may consultation pa sa doktor. Kasi iinom ka ng pill. Para siyang anti-pregnancy pill, no? So, dito may bayad pa. Pero ito ang kinagandahan sa nagtanong, by next year, ang Global Fund, once na-approve yung programa, ay magbibigay sila ng libreng PrEP, no? Pero tandaan natin, kahit libre ito, kung may bayad at kung ikaw ay gagamit ng PrEP, pang HIV lang to. Okay? So yung mga STIs ay hindi mapre-prevent ng PrEP. So pang HIV lang ito. So sa pagsagot, may bayad po ito. At meron na dito sa Pilipinas.
Yung pag-inom po ba niya is before or after sex?
Okay, dalawang pamamaraan yan. Either daily pill, iinom ka araw-araw para hindi mo na ma-estimate kung kailan ka makikipagtalik, or meron tayong tinatawag kung gusto mo magtipid per event. Yung per event, estimate mo. Halimbawa, makikipagtalik ako ng alas 12 ng tanghali. Iinom ka an hour before bago ka makipagtalik ng tanghali. Tapos, iinom ka rin ng isa after ka makipagtalik. And the following day, iinom ka ulit. Ang pinaka-problema niyan is, paano ka ba mag-estimate? Paano mo malalaman kung kailan ka makikipagtalik? So, yung iba ay araw-araw nila silang umiinom ng PrEP. Pero kung ikaw ay magaling mag-estimate, then wala rin problema, makakapagtipid ka.
Last question, sir. Hindi ka po ba ma-overdose and dito yung sa PrEP po ba, wala po ba itong side effect?
Okay. Ang PrEP kasi ay mild version ng antiretroviral. Ito rin yun yung, kumbaga, sa binibigay sa HIV ay mababa yung dose. So definitely kung ang ating mga doctors ay kailangan magkaroon ng konsultasyon dahil kailangan i-monitor. Kasi iba't iba naman yung effect sa isang tao. Pero karamihan ay walang side effect. Pero kung sakaling sa iyo ay may side effect, kailangan ka i-monitor. Kaya sa pag-inom ng PrEP, meron kang first or initial na consultation with the doctor, then after 4 months, and then later on, as long as you are being monitored by the doctor, then wala na tayong problema. So may monitor pa rin tayo. Ano ba yung minomonitor dyan? Yung liver, pinomonitor kung anong effect ng PrEP sa liver natin. At yung sa dugo natin, kasi kailangan malaman kung merong side effects o magkakaroon ng possible side effect. Tandaan din natin, ang PrEP, katulad ng may bayad ito, hindi lang to nakakapag-prevent ng STI. No? So yun lang naman yon.
Thank you po, sir.
Welcome.
And thank you so much for that question. So we have someone from Young Achievers Association. And thank you, Sir Iko, for shedding light, syempre, on more information about PrEP. Ayan. So we have another question dun sa comment box natin. So I'll be reading it. So it is from Yasmin Yap from STI College Pasay EDSA. So may I ask daw po, even if someone is not sexually active, is it still advisable for them to get tested or intake busy pills? Yan, Sir Iko?
Yes. Okay, bakit? For HIV testing, we advise everybody to get tested. Bakit? Hindi ibig sabihin na ikaw ay sexually active. Bakit? Kasi para maintindihan mo na napakadali at napaka-confidential ang HIV test. At para ma-break din natin yung stigma and discrimination surrounding HIV test. Bakit din? Paano kung ang iyong kaklase? Paano yung kaibigan mo ay sexually active? Paano mo siya mai-encourage na napakadali lang ang HIV test? Wala kang dapat katakutan. At very confidential kung mismong ikaw ay hindi pa naka-experience ng HIV test. So ang pinakamaganda dito is to become an advocate. Kaya we encourage everybody to get tested para ma-share ninyo. Paano mo ako i-encourage na magpa-test kung ikaw mismo hindi ka pa nagpa-test, di ba? We encourage all organizations right now, because of World AIDS Day, nakausap niyo po ako, Sana po ay pumunta kayo. Kailangan ma-break natin yung stigma and discrimination kasi ang HIV test ay parang regular test lang yan. Huwag na natin intindihin kung anong iisipin sa atin, pero pahalagahan natin ang ating kalusugan at kalusugan ng iba. Be an advocate.
And thank you so much, Sir Iko, for answering that question. So, yep, if you, Yasmin, rather, if you have additional questions or follow-up questions, i-chat mo na lang din dun sa comment box. So, I agree with you, Sir Iko. Talagang, siguro, just getting tested, it will send a message, especially to our peers and to the young people, that there should be no stigma about getting tested and knowing about your status. So, we have another question here from Wilfred Paliet from Aklan. So despite of the high number of youth daw po involved in early sexual activities and more vulnerable to diseases, bakit po hindi pa daw ina-approve ang sex education sa educational system natin? Especially, kailangan siya ituro as early as possible sa mga bata. And what can we do about it as advocates?
Okay. So, napaka-importante na tayo ay tulong-tulong. Ang Project Red Ribbon ngayon ay nakaupo na sa Philippine National AIDS Council at bibitbitin namin yung question mo. Bibitbitin natin yung suggestion mo para maisakatuparan at ma-push lalo. Ang mahirap kasi sa atin ay madali tayong magmungkahi pero napakahirap sa ating maglabi ng mga polisiya. Bilang mga organisasyon ng youth, ay kailangan natin i-push ito at kailangan mapakinggan din kayo. At tandaan ninyo, dahil nakaupo na kami sa Philippine National AIDS Council, ay maisusulong natin yan. At tulungan nyo rin kami. Kagaya ng sinabi ko, global solidarity, shared responsibility, hindi lamang ito responsibility ng ating mga nakaupo sa gobyerno, but at lahat tayo. Now, bakit hindi pa? Kasi sa batas palaging ganyan bakit hindi pa? Maaring hindi pa napapanahon pero ngayon kailangan na nating isulong at sa boses ninyo pagtulungan natin. Kagaya na sinabi ko, nakaupo na kami sa Philippine National AIDS Council at tutulong kami para masulong natin yung dapat isulong, lalo na yung sex education, reproductive health at saka mga polisiya about HIV.
Ayan, so thank you so much, Sir Iko. And syempre, maraming salamat po for representing those advocates as the advocates of HIV/AIDS to a higher level po kung saan pwede tayong mag-lobby ng mga batas at pwede na magkaroon na po ng effect yung mga gusto nating ipaglaban. So maraming salamat po doon. So ayan, so this is the last call for questions. Baka meron pa tayo. Ayan, so countdown na ako 5, 4, 3, 2, 1. So wala pa rin questions. Ayan. So again, thank you so much, Sir Iko. So I know that probably you have a lot of other activities lined up for today's World AIDS Day commemoration, but still you managed to grace us with your presence. So we would really like to keep in touch with you. Saan po ba namin kayo pwedeng makontak, or if we want more information about Project Red Ribbon, saan po ba namin kayo pwedeng makontak or makita? Do you have a Facebook page or Twitter accounts po na pwede namin i-follow?
Okay, pero kaming Facebook page, yung Project Red Ribbon, number 1. Number 2, pwede kayong magtanong sa National Youth Commission dahil sila ang aming kapartner. O kaya, pwede nyo kong i-email. Ito yung email ko, it's eco@projectredribbon.org. Pero bago ako magpaalam, I would like to invite all of you to the World AIDS Day Philippines 2020. Ito ay spearheaded by the Philippine National AIDS Council. At pumunta lang kayo sa Facebook page PNAC PH. Doon ay iba't ibang mga organizations ang magbibigay ng message at napakaganda yung mensahe mamayang 4 o'clock ng Department of Health Epidemiology Bureau kasi i-release nila yung bagong HIV and AIDS registry at doon makikita nyo rin yung mga taong may HIV na nagpapatotoo at nagbibigay ng messages about World AIDS Day. So sana samahan nyo kami mamaya at hanggang December 15 yung celebration ng World AIDS Day.
Yan. Thank you so much, Sir Iko. Yan. So, if you have questions or yun, pwede nating iparating yung mga questions natin, further questions natin, or if we want further information doon sa mga sinabing contact emails and Facebook accounts ni Sir Iko. So yan, so before we let you go, sir, we would like to present muna a certificate of appreciation from NYC. So we have a virtual awarding of certificate. Ayan, so this certificate of appreciation is awarded to Mr. Iko Rodulfo Johnson. So in recognition of his invaluable support as our resource speaker during the NYC HIV awareness webinar for today, for World AIDS Day 2020. So given this first day of December 2020, virtually in Zoom, but in Quezon City, Philippines. So signed by our chair person and Chief Executive Officer of NYC, Mr. Ryan R. Enriquez. So let's give Sir Iko a virtual applause, syempre.
Thank you. Salamat po sa inyo lahat.
Yan. Thank you so much po, sir. And so I hope na puno tayo ng information during the presentation of Iko Johnson. So we are very lucky na during this day or during this time as well of the pandemic is we were able to get information, we were able to learn and equip ourselves with the knowledge we need in order for us to advocate for the HIV and AIDS awareness. So at this juncture, I would like to call on the NYC Executive Director, Christine Joy Escobar, for a short message to our guests and participants.
As we celebrate the World AIDS Day, the National Youth Commission continues its trust and core mandate as a voice and advocate of the Filipino youth. Hence, ensuring the maximum youth participation in all centers of the Philippine Youth Development Plan. Having the concerns and alarming cases of reproductive health, particularly the HIV/AIDS, should be given with the most effective and efficient approach and strategies. With this, my sincere encouragement to our fellow Filipino youth to join hands and actively participate in all of our undertakings as we combat and halt the spread of this epidemic. We need to inculcate the most accurate information and much more, instill the importance of education as a powerful tool for prevention. Lastly, I humbly ask for everyone's support in our campaign for anti-discrimination to our brothers and sisters who were found to be positive in this virus. It's about time to end the stigma and embrace them as an integral part of our society. Stay safe always to you and your family. God bless and more power to all of you.
Ayan. Thank you very much, Executive Director Christine Joy Escobar. So, syempre, maraming salamat dun sa message na binigay niya sa atin. And really, tayong mga kabataan talaga sa atin ay palaki yung daladala natin na torch, kumbaga. This generation ay malaki yung pressure on us to really fight for the things that we advocate for. And isa na nga dun is yung HIV and AIDS awareness. Ayan, so at this juncture, let us all get involved in raising awareness about the HIV epidemic and how it impacts the young Filipinos. So bibigyan ko lang kayo ng konting information. So the trend in HIV infections in the country continue to rise. So with 3,752 infections from January to June 2020 alone. And the total infections in the country now stands at 78,559 cases. And that is sobrang dami nun. So from April to June, there were 934 cases reported by the Department of Health, HIV/AIDS in ART Registry of the Philippines, which is tinatawag natin HARP. And out of the 934 reported infections, 259 or 28% of those cases were among youth 15 to 24 years old. And 93% of those youth are males. So, and that is almost all of the 15 to 24 reported infections. So, ganun nakadami And we are telling you these statistics because we want to emphasize the importance of the involvement of the youth when it comes to the fight against HIV and AIDS epidemic. So our collective resolve to end the HIV epidemic, to show our collective resolve to end the HIV epidemic, let us show support for people living with HIV and remember those who succumb from AIDS-related illnesses. To show our unity and support, we request our participants and guests to change their virtual backgrounds and use the ones provided by the organizers. So you may also opt to display a red ribbon to show your support. So any red ribbon will do naman na. Ayan, so I'll be requesting ang ating host ng Zoom chat to please send the link. So para makapag-change tayo maka-change yung participants natin ng kanilang virtual background. Ayan, so kung wala kayong idea how to change the virtual background, pwede yan, you just click on the parang drop-down box or drop-down list near the camera icon, start video icon, tapos choose virtual background lang tayo. So pwede rin if you have red ribbons, so pwede rin natin siyang gamitin because the red ribbon is the symbol of this advocacy. So against HIV and AIDS. So ayan, I'll check kung kayo ba ay nagbubukas na. Ayan, so madami na yung nakabukas and nagpalit na ng kanilang mga backgrounds, virtual backgrounds. So also, sinend din ng ating prod team yung ating background. So you may download it. Ayan, sige, magpulbo-pulbo muna tayo, mag-ayos-ayos. Ayan, so also as I've mentioned earlier, take this opportunity to network as well. So we have participants here from Cagayan, from Zambales, from Zamboanga del Norte, to Capiz, to Tarlac, all of those places. And this is a good opportunity for everyone na makapag-network. And maybe if you have projects that you can, pwede nyong mag-collaborate, makapag-collaborate tayo doon. So magandang opportunity to for networking. And, ma-scale up natin yung ating reach. And siguro, let's give another 30 seconds siguro, para makapagpalit yung mga, participants. So again, if you have questions, if you have insights, ayun, just put it on the comment box. So, wag tayong mahiyang mag-comment or magbigay ng suggestion. As long as, syempre, it's on the right time, kasi baka mamaya during the discussion tayo mag-question or during a certain message tayo magtanong. So, we can do that habang ginagawa natin itong photo op natin. Ayan, so from Young Achievers, I think pag naka-phone, hindi ako sigurado kung kaya magpalit. But if you have a red ribbon, so pwede rin na gumamit ka ng red ribbon to signify your support na lang. Ayan, so baka meron kayong something na pula dyan sa mga kasamahan natin dyan. Ayan, so syempre ako rin, in Zoom, I will also be changing my background. And then you just put on your best smiles because in a while, we will be having our photo opportunity. Ayan, so may we request na po ang ating prod team to take this ceremonial or symbolic photo op natin. Sige, steady lang tayo, ngiti-ngiti lang kasi kinukuha tayo ng picture. So we have how many? 115 participants. So sa Zoom, mga nasa 5 pages. Ayan, smile lang. Kaya hanggat hindi tayo binibigyan ng go signal ng prod team to stop smiling, project lang tayo sa mga camera natin.
Okay, we're done with the photo, with the solidarity photo.
Ayan, so thank you so much po, Proud Team. And thank you so much to our participants and guests who joined this photo opportunity. So, this symbolic activity is our solidarity message with the rest of the world and to young Filipino PLHIVs. So, if you don't, ayun, so this activity, though symbolic, is our commitment of support to our peers, to people living with HIV, and to the advocates who continue to raise awareness. And to the advocates who continue to raise awareness about the HIV global pandemic. So now, to formally close our activity for today, let us hear a closing message from the NYC Chairperson and CEO, Yusek Ryan Enriquez.
Isang makasaysayang pagbati sa dangal, lakas at galing ng bayan, kabataang Pilipino. Malugod kong binabati at pinapasalamatan ang ating mga kawani sa National Youth Commission sa walang sang programa para sa ating mga kabataan, kagaya ng ating pinagdiriwang ngayong World AIDS Day. Tagumpay muli tayo sa pagbibigay kaalaman sa ating mga kabataan kung gaano kahalaga ang pagbibigay pansin sa mga issue at problemang kinakaharap ng ating mga kababayang HIV positive. Kahit may pandemya ay patuloy ang atin ang mga maling pagtingin at diskriminasyon. Tanggalin ang takot at pangambang nagmumula. Pasan, nararapat din namang natin isulong ang pagkikayat sa mga kabataan na magpa-HIV testing, lalo na ang mga aktibo sa kanilang mga relasyon. Mas mainam na naagapan ang posibleng suliraning idudulot sakali magkaroon ng mga sintomas ng HIV infection. Ang National Youth Commission ay palaging gagabay sa ating mga kabataan hagi ng kaalaman at karanasan na hindi kayo mawala sa tamang landas at lalo maging kaisa ng ating pamahalaan sa pagpapalaganap ng mga tamang prinsipyo at makabuluhang proyekto para sa inyong lahat. Makakaasa kayo na patuloy na magiging boses ng kabataan ang NYC at magiging inyong tanggulan sa paglilingkod para sa bayan. Nawa, ang pagdiriwang na ito ay hindi lamang maging isang simpleng programa upang mairaos lamang ang ating kampanya laban sa HIV/AIDS. Kung hindi ito maging isang malakas na panawagan na tigilan natin ang pangungutya at pagpapakalat ng maling kaisipan tungkol sa HIV/AIDS, bagkus ay yakapin at mas mahalin natin sila dahil walang ibang magtutulungan kundi tayong mga kapwa Pilipino rin. Patuloy po tayo magiging sandigan ng pagbabago at iparamdam ang malasakit para sa isa't isa.
Thank you so much, Chairman Enriquez. Ayan, so a few announcements before we end. The Secretariat has provided a link to the feedback form that we need to accomplish in order for us to receive the certificate of participation. So kindly fill it out so you can receive your certificate of participation. So, ayan, nakita naman ba nasa comment or chat box or sa comment box yung ating feedback. So in order for you to get your certificate, you need to answer that feedback form. And so truly what we have witnessed here is the collective voice of the young people pushing for change. You have made known to the world that the voice of the young people matter. So we will march on and continue with our HIV awareness advocacy until the tide is turned and the red ribbon becomes the symbol of our triumph. So in behalf of the organizers of this webinar commemorating World AIDS Day, this is Dion. Maraming salamat at mabuhay ang kabataang Pilipino.
I didn't ask for a free ride. I only asked you to show me a real good time. I never asked for the rainfall, at least to show to thin it out. It's coming down on me. Water like misery. It's coming down on me. I'm ready, rain on me. Drop, but at least I'm alive. Rain on me, rain, rain, rain on me, rain, rain. I'd rather be drop, but at least I'm alive. Rain on me, rain, rain, rain on me. Living in a world where no one's innocent. Oh, but at least we try. Gotta live my truth, not keep it bottled in. So I don't lose my mind. Baby, yeah, I can feel it on my skin. It's coming down on me. Teardrops on my face. Water like misery. Let it wash away my sins. It's coming down on me. Let it wash away. I'd rather be drunk, but at least I'm alive. Rain on me, rain, rain, rain on me, rain, rain. I'd rather be drunk, but at least I'm alive. Rain on me, rain, rain, rain on me.
Hands up to the sky. I'll be your galaxy. I'm about to fly. Rain on me, tsunami. Hands up to the sky. I'll be your galaxy. I'm about to fly.